This topic is viral rhinitis. Viral rhinitis is a mild viral upper respiratory infection. This is what we commonly refer to as the common cold. This is a viral infection, so antibiotics are not needed. Rhinovirus is the most common virus that causes viral rhinitis, but this can be caused by a whole host of viruses. Whenever the virus infiltrates the respiratory tract, this initiates or triggers an immune response, and therefore we have an inflammatory response. Viral rhinitis, because it is a virus, is self-limiting, which just means it'll go away or resolve on its own, but this can last for up to 1 to 2 weeks. This is a highly infectious and contagious virus. Risk factors for viral rhinitis include anything that can cause immunosuppression, so stress or even allergies. And being in a crowded place, specifically in the winter months, can increase your risk of developing viral rhinitis. Clinical features include anything you've experienced with a cold. This includes nasal congestion and rhinorrhea, even sneezing. Clients can experience a sore throat, and this is due to that inflammatory response. Sore throat can also be exacerbated by nasal discharge and drainage that drips down the throat. This is commonly known as postnasal drip, and this can actually cause a cough as well. The client can experience low-grade fever as the body is fighting off this viral infection. Headaches can occur due to sinus involvement and nasal congestion, and malaise, or generalized body aches. This is again due to that inflammatory response throughout the body. The most important thing to focus on here are the complications that can occur from viral rhinitis. These are all due to secondary infections. Sinusitis is when the sinuses become inflamed and bogged down with this nasal congestion. If the client isn't able to effectively clear that nasal congestion, this can lead to a bacterial sinus infection. Otitis media, or a bacterial ear infection. This occurs when the inner ear is unable to effectively drain down into the throat. Clients can be at higher risk of inner ear infections when they do have a common cold, as they have increased nasal secretions. Tonsillitis occurs, an inflammation within the tonsil. This can lead into a bacterial infection within the tonsil. Lung infections, such as pneumonia, can also occur. And this can happen if the client is unable to expel their secretions, and that mucus can sit in the lungs and be a breeding ground for bacteria. Let's discuss our nursing interventions for clients with viral rhinitis. With viruses, we really need to offer supportive or symptomatic care. This includes hydration or saline nasal sprays or rinses. Both of these mechanisms can help bring moisture into the mucus, thin it out, and loosen it. This will encourage drainage and allow the client to expel these secretions. Gargling salt water can be helpful to remediate that sore throat. This will help decrease the inflammation and cause less discomfort to that sore throat. Rest. The body's fighting an infection, so it does need rest in order to do this effectively. Mild analgesics can also be helpful for headaches or a generalized malaise. Antihistamines can be helpful to decrease this inflammatory response, but it's important to educate clients and families not to use these antihistamines for long-term use, or any more than about 3 days. Same rule goes for decongestants. This can be helpful for short-term symptomatic treatment, but it's advised to not use decongestants for more than 3 days, as this can cause a rebound rhinitis. It's also important to know that children under the age of 6 are not advised to use decongestants. Our prevention is going to focus on decreasing the spread of infection. So, proper hand hygiene, covering our coughs and sneezes. Most viral respiratory infections are spread through droplets within the air after we cough or sneeze. So if we cover this, we can decrease the spread. And using facial coverings to protect ourselves and others. When it comes to educating our clients with viral rhinitis or families, we need to make sure that they're aware of what symptoms to monitor and report. Most of these symptoms are related to or signs of a secondary infection. These can include a higher fever of 103 or above, tender swollen glands or lymph nodes, and increasing ear or sinus pain. We discussed these secondary bacterial infections that can occur, and these are absolutely signs that need to be reported, especially dyspnea or trouble breathing or purulent sputum. Now, I do want to make a differentiation here, and this is a very important note. Green nasal discharge does not mean there's a bacterial infection. It does not mean the client needs antibiotics. Green nasal discharge is absolutely a symptom of a viral rhinitis.